This video is about how to look after your episiotomy and perineal tears. Your perineum is the region between your legs that consists of skin, tissue and muscles. During childbirth, injury may have occurred to your perineum when baby came out. Here we've got a model of the perineum to show you. An episiotomy is a cut to the side to prevent a more serious tear to the back passage, but tears may have occurred around your perineum or within your vagina that could have required stitches. The stitches we use are usually dissolvable and allow the wound to heal within a month. It's normal to have a bit of discomfort, but this should be relieved with simple painkillers such as paracetamol. Here are some do's and don'ts on how to look after your perineum. Do get plenty of rest, especially in the first few weeks, to allow the stitches to heal, but continue gentle activity. Don't overexert yourself, but avoid too much bed rest as this can increase your risk of blood clots forming. Do use plain water to wash the area, especially after going to the toilet. You can use a jug or perineal spray bottle to help. You don't need to buy any special soaps or creams to clean the area, but can use existing products over the area, gently let it trickle over your perineum and then rinse off completely. Do go to the toilet at least every 4 hours in the first week or so after giving birth, and aim to take a daily shower if possible. It's okay to have a bath, but don't have the water too hot or soak for too long to reduce the risk of your sutures dissolving too quickly. Do pat the area completely dry with a towel after washing and change pads regularly. Don't leave it wet or damp. Do eat fruit and veg and drink plenty of water. Don't strain on the toilet. Ask your doctor or midwife if you require a laxative. Do practice pelvic floor exercises when able to. If you're not sure on how to do these properly, please have a look at the NHS site or discuss with your doctor or midwife for advice. Look out for the following signs which may indicate that your perineum is not healing properly: increasing pain, bleeding, itchiness, or an abnormal discharge or foul smell. If you have any concerns about the healing of your perineum, please contact the maternity triage for your hospital. Please see the numbers below and have a look at the following sites for more information.